Hi, this is Catherine. I wanted to show you a short presentation today about expressive language disorder, and it was written by my friend Claudia in Mexico. Some objectives of this presentation are to define expressive language disorder, tell you some symptoms, some treatment causes, and some possible diagnoses. So what is it exactly? Language expressive disorder is a kind of communication disorder, obviously. It is when a child has trouble talking and making themselves understood. This disorder might make it difficult for their friends to understand them, which of course always has a risk for developing learning problems or low self-esteem. They have a hard time getting their message across to others. They have a below average vocabulary. They might use the tenses improperly, like switch up past, present, and future. And especially when they're trying to make more complex sentences. They can have trouble asking questions, repeating words back to them, having trouble learning songs or rhymes. Sticks to group nouns, kind of like, says things a lot or stuff. It takes a lot for, the brain to get all those messages to the muscles, and there's a lot in that whole process of expressing, what you want to say. And if you can't, it is just so frustrating. So some of the symptoms might be problems remembering words, knowing fewer words than their peers. They can't remember what things are called, or possibly just using the wrong verb tenses, using the wrong pronouns a lot, such as, he, she, they, getting them all mixed up. They might just skip them, or they stumble over the words, or they just use really, really short sentences all the time. So some treatments for this can be speech therapy or language therapy, where your child will learn some words and phrases to help them make themselves understood. The therapist might teach them other ways of speaking, like including lots of gestures. In addition, a therapist might teach you some better ways to communicate with your child. Some causes, well, we really don't know. It's kind of not really well understood. It could be, poor nutrition or genetic factors. There might be some brain damage involved. We really just don't know, and we need to do some more research. Your child can be tested to see if they have a language disorder. They have two main kinds of tests. They have a standardized expressive language test and a nonverbal intellectual test. Using these tests together can really help rule out other kinds of learning disabilities. Because if your child has a problem expressing themselves, it can lead to other learning problems. It can lead to low self-esteem, which we know has a whole host of problems, social problems, maybe not getting along quite as well with their peers. And so some different ways that you can help your child is when they, they have a visual like this, like what shape is it? What size is it? What color is it? Ask them questions. What's it sound like? What's it smell like? And make them think about these things just in their everyday life to give them some more vocabulary. So these are some different references that Claudia looked at to make this presentation. But if you have any questions or you need any more information, please feel free to email us here at info@wellneuro.com. Thank you.